All right, it's 12 o'clock, so thank you everyone for joining us. I will be recording this meeting, so I'll get the recording started and we'll take it away. Is it? Yes. Hi, and welcome everyone to the Disaster Resilience Analytics Center seminar series at Wichita State University. Today's talk, Disaster Preparedness and Emergency Management in South Central Kansas, will be a panel discussion featuring regional public safety and emergency response leaders with extensive experience at the national, state, and community levels. Our moderator, David Shin, will lead the discussion, and we'll have time at the end for questions from the audience. David Shin has been working in the field of medicine since 2002 and has established and maintained multiple organizations and companies in the fields of public safety, search and rescue, and professional education. With that, I will hand it over to David to introduce our panelists and get us started. You are muted.
You guys can't read my lips? Good afternoon. Thank you very much for joining us. We have a fantastic panel of guests here. We have years of experience and background that we have. Today, we'll just be addressing a few basic questions, starting off with what exactly do we do to be prepared for a disaster or any type of major situation where the community needs to respond, and how quickly are we able to recover from that sort of situation. We'll be looking at how have we done this in the past, what are we doing currently, and what are we going to be doing in the future. Just to quickly introduce some of our panelists here, we have Dave Johnston, Terry David, I don't see Kyle Burtch.
Yeah, he was on a minute ago.
I saw him a second ago, but now I don't see him. And where is, do we just have the four in the?
Everyone's here.
Yep,
everyone's here.
Jaime also.
Jamie's here.
Yep.
And Jaime, real quick, I know your last name has changed. What is your last name now?
Anderson.
Anderson, thank you.
It's okay.
But Dave Johnston, currently, he is actually the director at Reno County EMS. Terry David, just a real quick rundown of where everyone has landed at this point. Terry David is the council, I'm sorry, Terry.
County Commissioner.
Thank you, County Commissioner for Rice County. Kyle Burtch. Is Kyle here? Okay,
yeah,
Kyle.
I'm here.
Okay, Kyle, you have jumped up the ladder so quick. You're director of operations. You're the
Major and Chief Workforce Officer.
Major and Chief Workforce Operator. All right. And then Jaime, you have jumped into so many different positions just of recent. Where exactly have you landed at this point?
Right now, I mean, I'm still serving paramedic for Sedgwick County part-time. I'm about to start with Mulvane as well, but my full-time position is the South Central and Southeast Readiness and Response Coordinator for Healthcare Coalition Partners of Kansas, which is under KDHD, and ASPR's our federal partner.
All right. David, what exactly have you got going on over at Reno County right now?
What have I got going to Reno County? Well, we're busy.
Yeah.
That's it. So kind of like everyone else, we're kind of recovering post-pandemic, trying to get working staffing where it needs to be at. So we're getting really close on that. And, you know, call volume's on the rise. So we're just managing that as it comes.
Kyle, as far as call volume goes, do you see an increase in call volume out in Sedgwick County as well?
Yeah, we're seeing a slight increase year over year, 2 to 3%. So last year we ran just under, it was 67,000 calls. This year we're thinking we're going to crest 70,000.
And then Mr. Terry David,
Yes.
now being in the past, just wearing so many different hats, as far as what you've seen in the past, maybe 10 years, our preparedness and readiness as far as just general call volume of medical emergencies and any other type of emergencies, do you feel that that has actually increased in the recent past?
Well, I think it has. In fact, I actually was EMS chief in Reno County and happily passed the gavel over to Dave. And I retired from 2 EMS agencies. And I would tell you, just in the short time, I've been gone 4 years. And I can tell you that I think in addition, it only reflects what the 2 gentlemen have already said, is that the call volumes are way up. No one can tell me why, other than in Kansas, we have an older population, and I can attest that people get older every day. And so, and you know, healthcare is expensive, and the other 2 guys could probably answer this more carefully than I, but when I was in Reno County, there was a large number of the population that was using EMS as their primary healthcare provider, rather than having a regular doctor, because it was easier to call 911 and get into an ER someplace a lot of times than it was trying to get a doctor's appointment 2 or 3 weeks out. So I think that's it. And times have changed. Social's changed. I don't know about Sedgwick County's situation, but Dave could tell you that you know, overdoses have went through the roof, and it was fairly rare back even 4 years ago that we were seeing the number of overdoses that they're seeing today. So hope that answered it for you. But I think nationwide, the call volumes are steadily increasing.
Jaime, real quick, where exactly have you landed, and what exactly are you doing in your organization at this point? I find this kind of fascinating here.
My position. So I left my full-time captain position with Sedgwick County EMS June of 21, finished my master's in public health administration, and I also worked for the American Red Cross for about 18 months. And through those connections is where and how I landed where I'm at right now. So healthcare coalitions, as we know today, really came into effect after 9/11 occurred, when the country realized, hey, we need a better response to med surge events. You know, when hospitals and resources get overrun with just massive amounts of patients, we need to be prepared and have better response to that. So under ASPR, healthcare coalitions were born. The 4 core principles for healthcare coalitions is public health departments, hospitals, emergency management, and EMS. And there's about 11 to 17 other subsidiaries of that. We got dialysis, hospice, long-term care facilities, to name a few, other local partners. So the whole point of healthcare coalitions is to bring the communities together for planning, exercising, collaboration. So when large surges occur, whether it's man-made or environmental, we are prepared as a community, have those connections, networking intact already to be able to respond appropriately and the best we can for the situation. So I help coordinate that through South Central and Southeast. I have those 31 counties. There's 19 in South Central, there's 12 in Southeast. But HCCP, which is the company I work for, we work under one umbrella. We're the only state right now in Kansas that works and functions as we do. We have 7 regions in Kansas alone, and we are all one company working together. What this means is that we collaborate immediately. We use teams. We have backups for everybody. Information sharing is much faster, and we're very, very consistent. And this is something that's growing. HCCP only came into being since 2019, and then COVID hit. And so we're also in this really big growth phase right now with the company after we're recovering from post-COVID. to the point where we were recognized in Region 7 for HCCs, which is Kansas, Nebraska, Iowa, and Missouri. And we're going to be presenting again this year at the national conference in Vegas at the end of the month as to how we function and why, just because our coalition here in Kansas is so very different. Otherwise, all the other states, most of the regions within states act independently. And so we're a little different here in Kansas.
So everyone here on this panel has responded to a disaster of some sort, whether it be a statewide or even national disaster. Everyone has a little bit of experience to some extent, or if not more. Currently, as we speak, in South Central Kansas, real quickly, in just a few words, how do you guys feel that we are prepared for an event that may come along? Now, when I say event, I'm not talking about just a natural disaster, but it could be something like another COVID. But just to be kind of vague, Kyle.
I think that we are positioned a little bit better than a lot of other people. We have a lot of good resources in Kansas, as Jaime said, like the healthcare coalition that we have here in Kansas is absolutely phenomenal. In fact, Sedgwick County EMS just got done training with them and different counties, the MSU team. So Dave helps run Region 3 EMS. So we have a lot of relationships and resources in place. And we have a lot of, I'd say we have a really good culture here in South Central Kansas where everybody trains together, everybody works well together. We do a lot of training when things are good, but we can always be hit by something that we don't expect. And right now everybody is hurting across the field with emergency medicine, both hospitals and EMS, with staffing and just keeping the regular flow of patients. So it's hard to keep that next level of preparedness. So I think there's always work to do. We do have some work that we can do, but we are in a really good spot for Kansas in comparison to a lot of our neighbors.
Mr. Dave Johnston. So Reno County being a little bit kind of outside of Sedgwick County and almost just isolated in sort of a way. We can't necessarily say it's a small town, but it is for the most part a smaller community. Do you feel that you have to depend on other resources or mutual aid outside more so than maybe a larger town like Topeka or Manhattan or Kansas City?
Yeah, certainly. And I'll lead a little bit into following up with what Kyle had said. I've been fortunate to follow Terry in a couple different roles. And one of those is the Region 3 chair, where we come together with all the 19 counties. We have right around 50 agencies that are all part of that regional council. And that is building a relationship. And this is EMS agencies and hospitals to build those relationships and work on things exactly what we're talking about, preparedness. And I do believe we are positioned better than a lot of other areas of the state. But I'll be up front, we're in a worse position than we were 10 years ago. Things have dramatically changed in the workforce. I hate blaming COVID on everything, but things have changed so much in the culture. Yes, much like it's really difficult to go get a good Arby's sandwich in a couple minutes or wherever. It's just changed. And so the number of people willing to contribute to volunteering, that's led to a lot of issues in rural EMS agencies, that they're not staffed where they are. We're in a crisis mode with some of them on the verge of having to shut down. The wonderful agency that was stood up was the Major Emergency Response Group, MERGE, and Terry David, he'll speak to it, certainly was a commander of that. That was brought on board as a major response to these large events. And unfortunately, over time, the commitment that's been given to that organization has dropped. And what I'll say, that's just been a change in the workforce that has contributed to that. Now, are we still prepared? Yes, we are. It's through these groups that get together. we're sharing response plans, we're sharing information so we can help each other out. And I rely on other agencies. I've got 5 ambulances staffed today. I top out at 7, so we hit a major mark. I've got to call others, and that's all come from relationships. I don't have a single phone number that I can call and say, I need help. I've got multiple directors' phone numbers in my phone that I'm calling and say, hey, we need an extra unit over here to come help us out. So, but we are better positioned than a lot of the US, and definitely better than a lot of the areas in the state of Kansas, just because of South Central Kansas and the relationships that have been formed. But I would say we're in a rebuilding phase at the region level. We're really pushing that. We have equipment and resources that's available to region agencies, and we'll push that out to help improve that preparedness response. But I don't know if we'll get back to where we were 10 years ago. I sure hope we do. And we've got a lot of smart folks, a lot of people committing to it. So I hope we get there. But, and I might just hand it off to Terry to talk a little bit about the response that we did have, the capabilities that we had in the region a few years ago, and thoughts on how we get back to where that was at.
And actually, we are going right into that direction. That's a perfect segue to get in that way. But before we move that direction, Mr. Terry David, so being a county commissioner, now you're actually in the preparation phase, not only in preparing for something to happen, but also currently dealing with things that are going on at this moment, and also having things that you have to have foresight for in the event that something happens in the future. How are we going to recover from that? That is a huge juggling act.
Well, it is.
Like that?
It is, and I'll tell you, a lot of places have the EMS director wears a couple of different hats. In fact, when I was the EMS director in Rice County, I was the emergency manager. I would tell you, counties do not spend enough money on emergency management, with the exception of the big ones. And so there's a lot of things that can fall through the grates. I would tell you that we also, in emergency management, said something that was very insightful. And from an elected position, people would go, you went from recovery or from response to recovery when somebody at a council meeting says, who the hell's going to pay for all this? When that's said, then you've made the jump from response into the recovery part of it. And I would tell you collectively, I sit on the Kansas Association of Counties Board of Directors, which sees a lot of different counties and a lot of different commissioners, and no one's really prepared. We in government, sometimes at a local level, but mostly at a state and a regional level, with the exception of Region 3, who's got their act together, and certainly a national level, government is grossly reactive rather than proactive. It's just the way it works. And it's changed again. I would tell you, I'm going to show my age to some of you. My first response to a disaster was April the 25th, 1991. If you were all alive then, raise your hand. That was the first Andover tornado. And Reno County, I was a paramedic there then, sent trucks over. Interestingly enough, in a big city, not to work the disaster, because Sedgwick County and Butler County had almost all of their resources over there. Our job was to run regular calls in Sedgwick County, because when you have a disaster that's isolated like a tornado, people don't quit wrecking their cars or having chest pain or choking on a green bean or whatever they do. So the calls still come into 911. Also, and I'll just briefly say this, is that response in the state of Kansas has changed for a number of reasons. One is because Dave is absolutely right. There's lots of places that don't have the people to go, and they can't give resources for long periods of time. And the other thing is that when the MERGE team, when the Emergency Medical Response Team was formed 30 years ago, it focused generally on tornado weather events. I mean, it happened I mean, I was medical branch director in Greensburg for 2 weeks, and we ran everything because the hospital was gone, and we worked in conjunction with the guard that came in and set up a hospital. But that's changed now because the weather patterns have changed. And I've talked to a couple of the television meteorologists about that very thing, and they think that's a pendulum that'll eventually swing back the other way. But the tornado alleys actually went down to the south, Oklahoma, Arkansas, Mississippi, down in that area. So I think, and I'm going to tell you from a perspective in a community like Lyons, where I live, that has 4,000 people, and we have 2 ambulances on at a time with a backup crew that's on call. The most dangerous thing that EMS has to worry about nowadays, as far as giving quality care, is shootings. I mean, those things you got to respond to right away. You don't have an hour to get a whole bunch of people in and try to organize people. You got to, it's labor intensive, and the clock is running literally the minute it comes in. We had a team that went to the Hastings shooting, and frankly, the reason that as many people survived as they did is that everybody in the building that worked there was smart enough to know how to put a tourniquet on. And they all pulled their belts off, and most of the people that were injured, they put tourniquets on. So I would also reiterate what Dave said. I think networking and having regional partners that you can call on a moment's notice is the way to alleviate the concern of having quick response for something that's not weather related.
Jaime, you're actually in a position where you have an organization that primarily builds on being prepared and also recovery aspect of that. How difficult is it to get funding at this point for recovery of something that hasn't even happened yet?
Coalitions are more focused around preparedness and response. We don't really focus too much on the recovery aspect of it. We handle issues that surround recovery, but the main point is preparedness and response capabilities. Now I do have access to, INA alert system. So like if any of you guys called me and said, hey, we have something happened in our county, we need help getting information out and resources. If you contacted me, then I can go and put an INA alert out to everybody on my distribution list across them. And then I can also talk to the other RRC, since we can literally have an alert put out within minutes to the entire state, just to have another way of getting messages out that we need help.
Now, Kyle, you've been with Sedgwick County for quite some time, and have seen some changes, and are currently probably going through some big changes there currently. What do you feel that you guys have done well, and what do you feel that could have improved that you've done in the past, as far as preparation for disasters and so forth?
So, like we previously said, I think we have strong existing relationships. I think we have great equipment throughout the state. We have strong partnerships. We've done really good on what we call the static mass casualty incident. So weather-related events like the tornadoes. We've had several large-scale events that all came out to be what we call static events, where we can go through traditional incident command structure roles. Probably, I think, across the country, the area where everyone lacks the most is exactly what to do and how to manage the dynamic MCIs. And that's the things like the Las Vegas shooting, where you are completely bombarded. Patients are being thrown in the beds of pickup trucks and brought to the hospital. And I don't know that anyone right now has a really solid, good plan on how to deal with that or train for those situations that don't fall into what we've historically gone for. But I think we've done a lot of training in the past. Luckily, when Dave used to work for Sedgwick County EMS, he set up a great system where we practice for large scale events frequently. We do lots of drilling. We do lots of interagency drills. But yeah, probably the big spot where we don't have good answers are those dynamic MCIs.
So there was a comment that was made by Mr. Johnston here that 10 years ago, we're not nearly as prepared as we were back then. What exactly were we doing well back then? That just defined for some of these people, that majority of the people that may be listening in have no idea. What were we doing and why were we in such a better position 10 years ago?
I think it would, be honest with you, is the ability to train more. Right now, the focus is on day-to-day staffing. As we've talked about, call volumes increased, workforce has decreased, and so we're focusing on those metrics a lot. And I think that there's just been a generic shift in the workforce. Is the idea of away time from work. Is we would have a lot of people that would contribute a lot of extra time, whether it's overtime and some would volunteer, all that, to put together training, large statewide initiatives, regional training pieces. And it's just been difficult to do that. There's still good stuff going on. You know, Kyle mentioned some of the training. I know the training down there. We've done a lot of training locally here. It's not as easy as it was. I think additionally, there's been demands on budgets have become hard. You know, workforce, spending a lot of money, and that's what we should be doing. We're behind the curve on pay, and we've brought that up. So it makes it difficult sometimes to get the additional funding so we can do some of the training items that we need to do. And I think there's just a tremendous amount of focus 10 years ago or so. There were people who were able to concentrate at the regional level. And Terry is very articulate in the piece about what they were training for, the tornadoes and things like that. A lot of effort went into that, develop these disaster medical support units. All of that was in place, and there were crews ready to stand up. And that's no small thing. That's an agency deciding that they're going to dedicate this part of their workforce to be a response portion. You know, Sedgwick County has been able to maintain a DMSU. A lot of other agencies that have those support units have not been able to maintain that just due to the training that's involved. So that's what a lot of the changes come from, is just shifts in workforce and time to do that training.
Terry, with the merge team and with Mr. Johnston as well, I mean, I remember you guys putting on these fantastic training events, some at the Marriott and whatnot, and they were things to take home back to your service for being prepared, taking care of the problem prior to it actually happening, and reducing the amount of recovery time it would take in the event that something happened. These were amazing training programs, and I don't necessarily see a whole lot of that anymore. Mr. Johnson, you just kind of touched on every aspect of that, why we're actually in that position. Terry, do you see that in the future that we may be able to get back to something like that, or is this kind of something that will not happen again?
You know, I think some of that might be a generational issue. I think that the workforce today's, I'm trying to look for the right word and not have everybody hang up that's on the call. I think maybe that's a workforce issue, that younger people, family is much more important. In fact, I would tell you, I've apologized to my kids numerous times that work was always more important than they were. And that was wrong. I somewhat paid the price for that and made up for that. But the other thing is that, and I can talk specifically about the merge team, is that almost everybody on the team retired, and there was no one to step forward to take the place. The other thing is that the team commander, frankly, using the language that I can, that's as soft as I can, was a dick, and that's me. And we had training sessions that you came to or you were no longer on the team at least 3 times a year. You wore a uniform. We had our own uniforms we wore. We had our own communication system with the state of Kansas that went away, that the state took away from the merged team. So there was a number of factors that played into that. And probably the number one thing is that if you don't have mission assignments as a team, then if you don't supplement that with good training, then you lose those people and you lose the interest and you lose the edge. And so that's the reason we were meeting three times a year for an entire day. And saying that, we also knew even back then when I was still doing it, that not having mission assignments and actually going to a disaster and being boots on the ground was a disadvantage. I mean, you can practice all you want on the street in a controlled environment, but until you, and I'll use this example, at the Joplin tornado at the Home Depot, they had 40 code reds on the ground at Home Depot. And until you have to live through that and have a good hot wash after that to say, this is what we really did well, and this is what we really did poorly, and this is the things we need to do to improve it, then it's tough. I mean, it's tough to maintain a level of enthusiasm and dedication to keep those kinds of programs running.
Now, Mr. Johnson, you're not quite there at the point where you're ready to pass the torch, and neither are you, Mr. David. But Jaime and Kyle, you guys have a lot of service left to give. Do you feel that this is a huge undertaking to actually try and drive the future of what we can do to be prepared? Kyle, go ahead and start there.
I think it is, like David and Dave have already said, we're facing a new generation. We are seeing greater turnover than in past. We lost a lot of experience in 2020, 2021, 2022. We're starting to see that tenure creep back up. But ultimately, when you come into an unfamiliar situation like a tornado or an MCI, there is absolutely no substitute for experience. You need experience. And when most of your workforce hasn't been through a true emergency, like Terry David said, you need that real life experience. You have to have gone through disasters. I think as we get our workforces, it looks like things are getting better. So as our workforces build back up, we get more fully staffed, we can dedicate more to training, and we see that tenure of employee creep back up. I think our emergency responses will be improved from that, because you don't want your first shooting to be 50 patients.
So Jay, seeing that you had your hand up here a second ago, but being in a position where you have to take a bunch of these different pieces and put it together so you're actually ready to be used or just have contacts in these contexts. Is this something that you're going to struggle with here in the near future, as well as whatever you had your hand up for? Sorry.
Sure, it's okay. It's a segue into it. So one of the biggest things, I hate to bring up COVID, but I mean, it completely changed the culture. It's a huge cultural shift after it. Before everybody was in person and everyone wanted to collaborate, and then we all switched to hybrid, or we realized that, hey, you can save a lot of money and time, and these kind of meetings are fantastic, but there's absolute no substitute for being in person, talking and building those relationships together. So that is one of the big struggles that HCCs amongst other organizations are having right now, is getting people to come back together. And this, of course, is like this cascade effect where we lost staffing issues. Okay, well, people can't come in person because now that they lost staff, they're wearing so many hats, they don't have the time to do it. Then now they don't have the funding to be able to even drive to these meetings to come in person. And so it's this vicious cycle of everyone's trying desperately to get back together and collaborate, but it's because of this plus this is a huge barrier. And then you add in a whole bunch of other unforeseen things that are complicating things. Like I was just up in Kansas City this past week for several days for my Region 7, and one of the big issues that people are having problems with is this increase of weather events that are occurring. And there's a lack of education on what exactly does this mean. Because I'm sorry, like a 100-year flood, a 500-year flood, a 1,000-year flood doesn't mean it happens once every 100, 500, or 1,000 years. It's literally a percentage. You have a 1 in 500 chance of this kind of flood happening again. Well, all these floods are definitely happening on these grand scales more than once in 500 years, you know? So it's just trying to get an understanding of what the actual hazards are and what we really need to prepare for, and then getting people to come to these meetings and make these connections. That way, when, you know, for better words, shit hits the fan, we're all ready to go and work with each other.
So from just my opinion, I've actually been watching things slowly progress to a point where the ability to recover from any type of disaster is heavily dependent on how prepared we are. Preparation has actually gone a little bit to the wayside, and I feel it's actually getting worse. Can anyone dissuade me? Well, with that little bit of a hesitation and silence there.
Well, actually, I think you're probably right, but I would tell you that there's a huge, and I'm no expert in recovery. I'm in no, and I'm about to lose you, so let me plug in and then I'll talk to you.
But after this moment, what we'll do is I'm going to go ahead and go through everybody and ask just the one question. What is one thing that you would like to see improve for the future? What can we do, or not what can we do, but what would you like to see improve for response and recovery for disasters?
I can add on to at least recovery right now while Terry's getting plugged in. When it comes to like recovery, because this is kind of me pulling my other hat when I was with the Red Cross, is that many people have zero idea what kind of resources are actually available to them through nonprofits, other facilities and organizations. It's a lack of general knowledge. There's so many resources that go untapped, unused, that are there for the community. In fact, my capstone project that I did for my master's was on that kind of exactly that. Was like, there's so many resources. How do we get this information out to people? And because a lot of times, I mean, it's not necessarily a product problem, kind of like in COVID. From some of my meetings I've had here recently, PPE actually wasn't necessarily the big issue. It was distribution, is getting it to the people. It's just like, you know, that same thing goes with resources. Resources are there. How do we get it to these communities, and more specifically those more vulnerable communities that are in rural settings? Because in Kansas, you know, we have 105 counties here, 98 are considered rural. How do we get these resources to the people that a lot of them struggle even to be able to drive to their doctor's appointments an hour away? There's these massive like social determinant barriers of getting the recovery resources to people, if that makes sense. How do we overcome that?
I'm ready to be powered up here. You know, recovery, like I was saying, it's totally different than preparedness. And a lot of what Jaime's talking about can be mitigated with good preparedness, and some of it can't. But the recovery, even on a state and national level, is really it's unacceptable. And I'll give you a couple of good examples of that. Number one, the loss of the community of Greensburg during the tornado did not meet the state's requirement for a federal disaster. It did not. It didn't meet the threshold because it's based on total number of population and a number of factors. And the only reason that it made a presidential declaration was because CNN was there the next morning and broadcasting it all over the world that this town had been destroyed. my second part of that story is how inept the federal government is. I have a really good friend that lived outside of Fort Beach on one of the islands or peninsulas there during the hurricane, and that was what, 2 years ago. She still doesn't have a roof, and so there's a number of factors that figure into recovery. Part of it, and I'll get to this when you ask the final question, is you got to have a good emergency management system that deals with those resource issues. Because I've been on the governor's wild force task force for wildfires, and the Paradise fire that burned up thousands and thousands of acres. They had resources coming in, as did in Greensburg, almost immediately as far as helping people afterwards, but we had no one to manage them. And that's a key that needs to be done. You got to have logistics people on the ground almost right away to start helping manage those things. Up in Paradise, there were hundreds of semi trucks coming in with hay and things for the ranchers up there, and no one knew where to take it. I mean, there's some of those kinds of things as well. So it's not near what it needs to be, not only on a state level, but on a national level as well. And part of that's opinion. So
I'd like to chime in a little bit on that too. I feel like 10 years ago, we had a little bit of a smaller focus on what we were preparing for. So in some aspects, we are more prepared now. We're spread a little bit thinner because we have more threats. In the last 10 years, we had Ebola come to the United States. That needed an entirely different set of equipment and plans and actions that we didn't have in place before. Then we had COVID, another infectious disease, but needed an entirely different set of equipment, policies, and procedures than Ebola. We still have tornadoes, shootings. From my perspective, it seems like 10 years ago, we were still worried about school shootings, but we were thinking in the 10 to 20 patient range. And now we're looking at what do we do with 100 plus? Floods, wildfires, radiation events, dirty bombs. So we have seen lots of examples of large scale MCIs across the country in the last 10 years. So while our focus has been spread wider, I do think we now have a lot more relationships as EMS with emergency management, healthcare coalitions, and we are probably, from a planning perspective, a little bit better plan than we were 10 years ago for a wider range of threats. But that immediate scene response is the thing that has suffered with spreading thin over so many different threats.
Yeah, Kyle, you did a really good job of getting to the heart of that. And I don't want to detract, but I said things were better 10 years ago. It's just one of those. There's certain aspects it was, and you've hit the nail on the head. We've got a lot of great resources in specifically South Central Kansas. The folks work together, and we can take care of a lot of big issues. And that's just from the relationship piece. I think another thing that adds into it is nothing helps preparedness like a big disaster. That's where merge and a lot of other things come. The money flows, the training flows post disaster, and really ramp up things for a while. And so I think all the planning stuff that came out of COVID was good with that. And Jaime hit it on the head with not getting together, trying to get me. I haven't been to a healthcare coalition meeting since January of 2020. I do it online, and you miss out on something when you have that. Our region meetings, region EMS meetings, they're much better in person. You get to know folks, and that solidifies a better response.
Yeah, very good.
Gentlemen and ladies, or ma'am, thank you so very much. It's really good to see all of you together, honestly. The amount of information and experience and knowledge here is just beyond anything I can express. At this point, I would like to actually open it up. I believe we have quite a few questions that are actually floating around out there. I actually cannot see the chat. Actually, I could probably open it up here, but if anyone has a question, please.
Yeah, so thank you so much to our speakers. This was a fantastic and very insightful discussion, so I really appreciate your time. So if I could start off the questions. So our group, the Disaster Resilience Analytics Center, our goal has been to collect data and do research in a way that could help predict the resilience of communities before disaster strikes. But what has really been interesting to me, and all of you drove this home, is the amount that relationships really factor into the preparedness and eventual resistance. So, and that's something that can't really be, it's not quantifiable. That's something you can't really predict in a community. So my question is, what could the academic or the research community do that could help improve, or how could we work together with academics and your organizations to strengthen this?
You know, I think an interesting aspect, we hit on the relationships part, and I know we all keep coming back to that, is just from almost a survey perspective, the relationships that some of those agency leaders have with each other. And most of the time you can narrow it down to some organizations. For us, it's who's involved with the Healthcare Coalition, who's involved with the South Central Region 3 EMS Council. I think that those things right there, I've got a big predictor, and I'm willing to bet we can tell who's going to have a really poor response to something. It's the folks that aren't involved in those. You know, I can say that from personal experience. The leadership from agencies that don't engage with other agencies, that remain on an island to themselves, their response is poor. And so I don't know how you vet that out in a survey, but trying to see what I ask that when I'm looking for leaders, and you know, and I'm in a hospital, and we'll be bringing directors on for other departments. I'm asking, what memberships do you have with professional organizations? You know, in the state, who are you interacting with? Because that brings so much. I've learned so much from everybody on here in the past. So I think it's trying to quantify those relationships, how interconnected they are with other professionals I think would be really tied into the predicting on how well the response is and how quickly they can recover.
I found it interesting, Dave, that you said that a lot of places that aren't actively involved networking are at a disadvantage. I would tell you that I've been to probably a dozen disasters, and out of all those, 80% of them, either the EMS director and or the emergency manager got fired after the disaster.
Yeah.
And the reason is because they weren't prepared and they screwed it all up. And you know, you need to put as many fingers on the knife as you can. And so the more people you got coming in to help you, and you get that. I mean, our guys here in Rice County come over, and you guys come over, and you know, it's invaluable to have those pieces of the puzzle in place.
Yeah. Yeah. And you quantified how government handles disaster. They blame somebody, then they spend a whole bunch of money to fix it. So
Yeah.
I'm going to go back to understanding your resources. Like a lot of people are still learning what an HCC is when it comes to just capabilities, what we're doing. It's a young concept. It really is. And it's growing, and it's getting national recognition finally, but it is still a pretty young concept. I mean, most people don't know that. I mean, I have these distribution lists and contacts with, just in South Central, over 800 different facilities and organizations throughout those 19 counties, and about 350 for Southeast. Southeast is just less, just because it's lower populated. So maybe you want to get information out to me, whether it's training, alerts, warnings, job opportunities. I mean, if you go and you went to me, you would be able to disseminate this information out to thousands of people very, very quickly. So it's again, building those relationships, getting that information out and using your resources. That's why I'm here, is being able to collaborate like that. But a lot of people, maybe you didn't know that prior to today that I have that ability, but now you do. So how are you going to use that?
Jaime, do you think you're underutilized?
Yes, only because people are still learning what an HCC does. And again, it is, and again, it's very, very different in Kansas, just because we are the only state right now that manages the HCCs like we do. And so we are growing the concept of one umbrella, consistent collaboration, because again, we're the only company that all the readiness and response coordinators all work together. So if you had something, I mean, a good example of this is just this past April up in KCK area, there was a meatpacking plant up there that had issues with CO2. And, you know, KCK Fire, they were called initially, said one diff breather. They arrive on scene and there's a whole bunch of undocumented workers. And it was a very, very interesting dynamic scene where we had language barriers, fear of anybody in a uniform. And before they knew it, they thought at first it was an anhydrous issue because it was a meatpacking company, but nope, it ended up being CO2. But within a 22-minute time frame, when they realized, hey, this is kind of growing, we're not really sure what we have here, the RRC and Metro had already had all of us throughout the state on alert, like, hey, we're having something going on right here, you know, start paying attention. And then when we realized that, hey, it's CO2 and up to 80 patients may have needed treatment for this, they're all contacting us at the same time, like, hey, what resources do you have in your areas in case we need to fly people out, transport them on ground? And so that rapid communication throughout the entire state with just 7 people was imperative to being able to handle that. So again, it's all about communication, knowing your resources and using them.
Well, I hope you get a little exposure with this.
Yes, no pun intended. But, I know, I'm funny. I'm here all week. I'm really funny.
And I'll turn it over to Megan and Nathan.
Nathan, go ahead.
Well, first of all, I just wanted to thank you all. It's been really rich and informative. I'm part of the disaster resilience team here, and I was thinking about how we are working on trying to fine tune, especially in rural areas and across the region, predictive capabilities across different types of disasters. But we're having the same thing that I feel like I'm hearing from you on campus, where we're getting like a health humanities coalition coming around with the new biomedical center. And then we've got the disaster resilience and the environmental justice center. And every time I'm at one of these things, I'm like, why aren't we all helping and working together, right? So it's really, we have a strong education piece. I just wanted to tell you that throughout this thing, I've been getting messages from people from different colleges that had conflicts that really, so I feel like there would be much better questions that I lack expertise for. But for you to know that, because they'll all be watching the recording, and so gratitude from all those different pieces. One of the things I thought about was the health communications in languages, particularly Spanish, but other that we have larger communities of. It just feels like there's a lot we could do together. And my only real question was that I still wanted to hear the answer to David's last question from each of your perspectives of what would most improve if you had to pick one thing. But thank you. That's really what
Well, sorry, I'll give the easy answer, since I can start off with the one thing is always comes down to funding. It comes down, work at on legislative issues with the Kansas EMS Association. We're pushing the idea that's going in other states of making EMS an essential service. The way it's in statute currently is it's not listed as an essential service. It's if you have taxation for EMS, then a county or municipality is required to provide it. But outside of that, it's not required. And funding is really difficult, whether it's at the state for the disaster preparedness or it's at the local level just to provide staffing in communities. And that leads into the smaller communities where the volunteerism is really dropping off. It's probably gonna have to be that push, if possible, to regionalization or bringing folks on full time to have that available in their community. And that's from just the EMS day-to-day activity coupled with how you're prepared for a large disaster. So money's the answer for me.
Are there corporate partnership kind of things that happen between?
You know, EMS is an interesting profession. There are, you know, primarily there's government entities, third party, there's fire department, there's hospital based, and then there's private. So there is corporations involved. AMR is the largest, and was it GMR is their corporate entity. So there's some that are trying to make a profit out of it. EMS isn't a place to make a profit out of. So there's some there, but that I say that's probably the limited piece we have with corporation.
I'll go next. I want to talk about the initial incident. They preached to emergency managers that all disasters are local disasters. And really they are. And by law, the mayor or the county commissioner are the ones that are really based to being in charge over all that. And hopefully they're smart enough to let the people that they hire to do good work do it. But where I'm going with all that is that when you have a local disaster, whether it's a shooting or whatever it is, the call comes into 911. And if I had my dream today, there's well over 100 dispatch centers in the state of Kansas, and only about 20 of them operate under some kind of medical protocol. The reason for that is that most of them are located and under the auspices of the sheriff's department. And frankly, the law guys, and I was a law guys are the most important guys in the world to law guys. And so, you know, EMS is not the most important thing. And where I'm going with that is there needs to be in-place protocols as far as mutual aid. In fact, I would tell you, we have limited resources here, and we set exactly the same distance from Hutchinson, Great Bend, and McPherson. So if we have an accident in the far south part of the county, an automatic mutual aid agreement is to call Dave and send a truck automatically. If it's more than 3 patients or 4 patients, automatically the dispatch center calls Reno County and sends one of their people. My dream today is that if we could do that statewide, and there's systems to do it. Hutch Fire does it with a nationwide program called the Mutual Aid Box Alarm System. That's a statewide system in Illinois and Indiana and Wisconsin that has all that in place, where they have a card file. If they have an incident, they pull it up and know Reno County's available, Kingman's available, Newton's available to be able to send trucks right now, immediately to an incident. That's my dream.
I'll go next. So I'm going to try to make it very, very concise. Collaboration, education, dissemination. We got to bring people together. We got to get them in person. We got to educate all these different entities on what our capabilities are. I can tell you right now, from my 4 core disciplines, EMS is the one that's the most misunderstood. Every single time. Great, I'm gonna have to reboot in 2 minutes. I'm gonna talk quick. My computer's about to force it. Anyway, I can tell you right now that EMS is the most misunderstood discipline because people grossly but especially overestimate capabilities. People come in like Sedgwick County, you can go and you can transport people 2 hours outside if you fly them in. No, we have people got to take care of here. So getting the education to everybody as to what the capabilities are, who to connect with is vastly important. And then dissemination of information. You got to get it out to everybody in a timely manner. And if I get knocked off here, it's because my computer's about to reboot. But I appreciate you all in case I get knocked off soon. But that's what I want to improve on.
I'm going to echo Dave and just say funding before a big event. The event happens and then everyone wants to throw time, money, and effort into preparing for the next time. But by the time the next time comes up, we've already kind of lost it, because disasters kind of go in the waves where we have a big disaster. They throw money, time, and effort at it. It wanes over time because it hasn't reoccurred. Then something else happens and we get money and resources thrown at us. So just having consistent funding and planning, I think, would be the single greatest avenue.
We are right at time, but we do have a hand up from Savannah Pascal. So if anyone has the time, I would like to get to one last question before we wrap up today. Go ahead, Savannah.
Hello, thank you so much for all the wonderful information. And thank you for Nathan to telling me about this event. So basically what I mainly focus on is just disseminating information to Spanish speakers and like speakers of indigenous languages, because we have a lot of like indigenous speakers in Kansas that don't also speak that much English. So I kind of wanted to know like what might be your resources, or like what plans that you might enact just due to the rise of people whose first language is English in Kansas.
For my service through the hospital, we pay for translation services. That's for at the time of the incident. We're able to, I forget the name of the system. We pull it up on our iPad. It's FaceTime, and we communicate through the translator. And it's an incredible amount of different languages that are available for them to translate for us. That's the individual way that we're doing it. When we work with the other agencies and disseminate out response information, that's typically bilingual. We're not hitting everybody with that, but it's something that's probably grossly overlooked.
Sedgwick County EMS, same way. We subscribe to a translation app that all of our providers have access to on every single ambulance. Anyone with an iPad that works for us has access to those real-time translation apps that can either be audio or audio and video. For mass distribution of information, we would go through our communications department that has access to translation services and multiple languages, but typically we're hitting, Spanish and Vietnamese with mass marketing communication, but there is the ability to send that out.
Thank you so much.
Thanks.
Thank you.
Fantastic. I appreciate all of your time so much. I wish we could have a much longer discussion, but hopefully we can keep connections going in the future. So I very much appreciate your time today, and hope to work with you in the future. Thank you so much.
Thank you.
Have a good weekend. Thanks.